has here. And the question is, does he have to have surgery? And that's that question is always, it depends. It depends on what's going on with the person. It depends on specifically how bad is the pain. It depends on what are the other symptoms is he having. Is he having any symptoms going down his legs? Is the pain unbearable if it's getting in the way of his lifestyle, his work? All these questions are there. Are the symptoms getting worse or are they getting better? All these things you have to ask before you want to consider surgery. You also want to know, what conservative treatments have you done? There's different stretches and exercises you can do, yoga, tai chi, Pilates, acupuncture, all that stuff you can do. There's also injections, which he has had in the past that did help. There's epidural injections and facet injections and medial branch blocks and RFAs. There's a bunch of other procedures you can do before you get to the point of do I need surgery? And I've said this before. When you're considering surgery, you have to consider, have you done all that other stuff? Is the pain getting worse? Are there symptoms going down into my legs that are getting worse? If all these questions are yes, 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 it starts to point more towards the person possibly having surgery. But you want to definitely exhaust all the natural stuff that you can try, all the conservative stuff that you can try first. So that would be my answer to this person. There's a lot more questions though before I'd be able to actually give an answer that I have to know about his condition and what's going on. Actually, he states that it's only bothering him more so in the morning times, and throughout the day it gets better. That kind of leans towards possibly trying a lot of conservative stuff before you want to rush to surgery. Listen,